I will be audible very clearly. So mention yes in chat box if I am audible. So we will start our session. I am waiting for your response. So if I am audible, kindly mention in chat box. So I will begin. Okay, hello everyone. Hello Arju, how are you? Very good evening. How are you? I'm fine. So I hope I'm audible. So right now I'm live on YouTube as well as Instagram. So I have access of YouTube right now. I'm just trying to access Insta as well. So if you will ask any query on Insta, so I will be able to answer. Hello Priyanka, how are you? Hello Rehnuma. Hello Sanjeevni. Hello Ritu, how are you? Okay, Sanjeevni mentioning you are audible clearly. Great. So hopefully you all are well and you all are doing preparation for your psychology entrance examination. And there will be problem, I know there will be problem, you will face right difficulties, but take them as a challenge, right? Try to learn from authentic resources, all these. So these are QA sessions. So I'm not going to give you any lecture and all. These are the purely QA session, and many individuals requested me to answer in Hindi as well, right? Many individuals requested me to say something in Hindi also. So this session will be in bilingual, Hindi and English. हम दोनों language में बात करेंगे. So if you have any doubt, any query, you can mention. But before that, I want to mention one thing. Right? Many individual messaging me from last few months कि MPhil discontinue हो गया क्या, right? MPhil in clinical psychology, because according to new education policy, right, ये news है, राइट सो ये पार्शियली करेक्ट है, कुछ चीज़ें इसमें करेक्ट भी है, कुछ रॉन्ग है, राइट. आई जस्ट वांट टू क्लियर ऑल दोज. फर्स्ट ऑफ ऑल वी नीड टू अंडरस्टैंड कि एमफिल, राइट, साइकोलॉजी में दो एमफिल है. वन इज एमफिल इन साइकोलॉजी, दैट इज रिसर्च ओरिएंटेड, राइट, कोर्स. सेकेंड इज एमफिल इन क्लिनिकल साइकोलॉजी, जो रिसर्च ओरिएंटेड नहीं है, दैट इज बेसिकली फॉर द लाइसेंसिंग प्रोसीजर. सो इफ एनी इंडिविजुअल वांट टू टेक लाइसेंस फ्रॉम रिहैबिलिटेशन काउंसिल ऑफ इंडिया, राइट, दे कैन डू दिस एमफिल इन क्लिनिकल साइकोलॉजी. एक वीडियो भी मैंने इस पे बनाया था बहुत टाइम पहले, जब न्यू एजुकेशन पॉलिसी अनाउंस हुई थी, उस टाइम भी हमने इस पे बात की थी ऑलरेडी कि एमफिल इन क्लिनिकल साइकोलॉजी डिसकंटिन्यू नहीं होगा, right? Or those MPhil will be discontinued, that is research oriented. So MPhil in clinical psychology will be discontinued, but MPhil in MPhil in psychology will be discontinued. MPhil in clinical psychology will not going to discontinue. मैंने उस टाइम भी बोला था कि हो सकता है, पॉसिबिलिटीज है कि इसके नाम को हम चेंज कर दें, बट ये डिसकंटिन्यू नहीं होगा, बिकॉज दिस इज नॉट फॉर द रिसर्च, दिस इज राइट a kind of course. After that you are getting license, so this must be very clear here. Now, right, I'm going to take all your queries. So Sangram, hello Sangram, how are you? Monica, good evening Monica. Rusa, thank you for session in advance. Welcome Rusha. Same here Arju. राइट, आई ऑल्सो फील गुड, राइट, वेन एवर आई एम टॉकिंग टू यू. तो मुझे भी बहुत अच्छा लगता है वेन आई एम इंटरेक्टिंग विद यू. सुरेंद्र सिंह हेलो सुरेंद्र. प्रियंका, गुड इवनिंग. ऋतिक, इज एमिटी यूनिवर्सिटी ग्वालियर is good institute for MPhil? Ritik, yes, basically I hope you will be able to categorize, right? There are different kind of universities, government, right, private, deemed to be. If there are government, there will be central, state. So Amity University comes under private, right? And if you are thinking about any private organization, then Amity, right, will be on top, at first to second or third position. So if you are thinking to pursue MPhil from private organization, then definitely Amity will be, right, an option. right? Monisa, good evening. Priyanka Sharma, right? You are mentioning, so which concept should be focused on particularly for NIMHANS MPhil Clinical Psychology entrance exam? Priyanka, I just want to mention one thing, right? I am receiving this kind of query every day कि इस एग्जाम के लिए क्या फोकस करना है या CIP के लिए क्या फोकस करना है. आई वुड लाइक टू मेंशन वन थिंग जिस पे हमने पहले भी एक वीडियो मैंने बनाया था. वो वीडियो लाइव है, डिटेल में यू कैन वॉच दैट पर्टिकुलर वीडियो. वहाँ से बहुत सारा इंसाइट मिल सकता है. वन थिंग दैट वी नीड टू कीप इन माइंड, you don't need to study for NIMHANS specifically or specifically CIP, right? These kind of mistakes we are doing. We can take one example. Suppose that from the biopsychology in NIMHANS there will be 6-7 questions. This is an hypothetical example I am taking. And in CIP if there will be 12 to 15 questions. दोनों के क्वेश्चंस में तो डिफरेंस है, बट निमहांस में अगर कम भी है और CIP में ज़्यादा भी है, उसके लिए भी हमें पूरा सिलेबस कंप्लीट करना होगा. दैट मीन्स कि नंबर ऑफ क्वेश्चंस कितना आएगा इन एग्जामिनेशन, राइट, वो हमारे राइट प्रिपरेशन को इफेक्ट नहीं कर सकता. बिकॉज अगर 7 क्वेश्चंस भी आएंगे तभी भी मुझे पूरा सिलेबस कंप्लीट करना है. अगर 12 क्वेश्चन भी आया तभी भी पूरा सिलेबस हमें कंप्लीट करना ही पड़ेगा. But yes, one thing that I want to mention, right, there are no doubt there are few specific chapters or we can say topic that can play very important role in any entrance examination. Specifically you are mentioning about MPhil. That will be cognitive part, right, like cognitive, like bio, like personality, like human development. All these are playing very important role in any right entrance examination. What happen जब भी हम MPhil इन क्लिनिकल साइकोलॉजी एंट्रेंस की हम बात करते हैं, बिकॉज उसके साथ एसोसिएटेड है क्लिनिकल साइकोलॉजी, MPhil इन क्लिनिकल साइकोलॉजी, तो हमें लगता है क्लिनिकल साइकोलॉजी से ज़्यादा वेटेज रहेगा वहाँ. कभी कभी हो सकता है, पॉसिबिलिटीज़ है, बट हमारी प्रिपरेशन में राइट हमें उसको ज़्यादा वेटेज नहीं देना. राइट हमारे लिए जितना भी मैंने अभी बताया यहाँ क्लिनिकल अलॉन्ग विद द क्लिनिकल, बायो, कॉग्निटिव, ऑल दीज, ह्यूमन डेवलपमेंट, पर्सनैलिटी, ऑल दीज विल बी इम्पॉर्टेंट. एंड अकॉर्डिंग टू मी when you will complete cognitive, bio, human development, personality, then you can go with the clinical, right? तो clinical beginning में बिल्कुल choose नहीं करना, right? Because that can create, right, problem. That is not a good strategy. So I think this will help you. Next, Sanjeevani mentioning, does the RML college MPhil course offer any stipend? Yes, they are offering a stipend, right? One thing that you need to understand, every year their administration, right, deciding how much stipend they are going to give, dena bhi hai nahi dena. So maybe this year maybe there will be certain changes, maybe next year you can find certain changes, but whenever you are taking admission in government organization, in almost all government organization you can find a stipend, less or more, that is a different thing, but you will get a stipend. So basically I am trying to find, right, how I can see live session on Insta, because maybe there will be few individual, right? Okay, I got right Insta, so I'm just going to take query from Insta as well. Hello Srijan, how are you? Srijan mentioning, sir, what are core topic chapter 2 clear PGI Raipur MPhil clinical psychology? I think Srijan, I answered this particular question, so I think that will help you out. DV Sharma, hello DV Sharma. So what is if we study from non-RCI college, can we still practice? Okay, you are mentioning if you are going to study from non-RCI affiliated college. One thing that we need to understand, to practice as a clinical psychologist as well as a rehab psychologist, there are two specific fields, clinical, rehab. So if you want to practice as a clinical, as a rehab, then you must have license, right? Without having license, you cannot use this designation, right? But you can practice as a counselor psychologist, child psychologist, you can practice, right, without having license, RCI license, but you must have appropriate डिग्री, अप्रोप्रिएट स्किल्स, यू कैन अंडरस्टैंड कि मैंने प्रैक्टिस स्टार्ट कर दी, हम कर सकते हैं एज अ काउंसलर साइकोलॉजिस्ट आफ्टर द मास्टर, राइट, यू कैन स्टार्ट प्रैक्टिसिंग एज अ काउंसलर साइकोलॉजिस्ट. बट career कितना सक्सेसफुल होगा if any individual doesn't have appropriate skills. So this is skill based practice, right? This is not only about कि right मेरे पास डिग्री है, so I'm just right doing something. अगर किसी इंडिविजुअल के पास लाइसेंस है क्लिनिकल साइकोलॉजिस्ट का भी, देन ऑल्सो राइट उसका करियर कितना ग्रो करेगा, दैट विल बेस्ड ऑन देयर स्किल्स. Right. Similarly, if any individual want to practice as a child psychologist, as a counselor, right, counselor psychologist, we need to focus on skills, right? Hope that will help. Saira, hello, Saira. How are you? Vanathi, hello. Subham, hello, Subham. Nisu, hello, Nisu. Okay, so I'm going to take one more query from Insta as well. Sneha Sarma, I think. Sir, I am a student of BA in education and I want to pursue MA in education, so need your advice. Basically, Sneha, right now we are discussing about psychology, and I'm thinking, right, I have little bit of information about psychology itself, so just excuse me, right, because you are right asking question related to MA in education, right? Okay, so now I'm taking few queries from YouTube as well. So Ram mentioning, hello Ram, sir, I have two doubts. Okay, sir, what's the primary difference between PDCP program and MPhil in clinical psychology? Ram, I think this is very genuine query जो बहुत के माइंड में होगा. What is the difference between these two? Because after both individual can get license from RCI. So what is the difference? सबसे पहला तो टाइम का डिफरेंस है. एक साल का होगा और दूसरा राइट एक से 1.5 साल का और दूसरा 2 साल का. MPhil will be there for 2 years. But one thing you need to understand, the major difference is when you are right completing right professional diploma in clinical psychology, you get license, but you are getting license of clinical psychology associates. So you cannot make career in education in further. Suppose that if you want to be a guide of someone in future in college or universities, so that are not going to allow you, right? You will be right clinical psychology associates, right? So you need clinical psychologist for certain things, right? But when any individual getting license after MPhil in clinical psychology, so they are getting license simply of clinical psychologist. They will not be associate, they will be clinical psychologist. So these are the basic difference. Hope this will help you out. Hello Ritu, welcome Arju. Ritu mentioning, sir, MA in psychology के बाद क्या करें, प्लीज एडवाइस कीजिए सर. रितु, वन थिंग दैट आई वांट टू मेंशन, आपने क्वेश्चन हिंदी में पूछा, आई रियली लाइक इट. सबसे पहले तो हमें ये देखना है कि मेरा इंटरेस्ट कहाँ है, राइट? इंटरेस्ट के बिना जब भी हम कोई भी स्पेशलाइजेशन चूज करते हैं तो कुछ टाइम के बाद थोड़ा सा करियर में डिक्लाइन होता है, बिकॉज यू विल नॉट बी इंटरेस्टेड, मे बी राइट यू विल थिंक राइट ये फील्ड मेरे लिए नहीं है. सो MA के बाद राइट देयर आर सो मेनी स्पेशलाइजेशन, राइट? मे बी देयर you can choose clinical, maybe counseling, maybe social, right? Maybe there are so many, child, educational, rehab. So I will suggest you to do certain internship here and there and try to explore in which specialization or in which area, right, you feel that kick, or when you are doing that kind of work you really feel good or enjoy that particular kind of activity, then choose a specific specialization. I hope this will help you out. If you have any right query related to your career, you can ask me, right? My social media handle is Arvind Otta. You can message me, I will try to reply you, or you can ask same questions to UPS team as well. So they are very prompt, right? They will answer you, very quickly, right? So you can send your queries to UPS as well as to me as well. uh, uh, Arju mentioning what is scenario nowadays in permanent job for a clinical psychologist. Arju, बहुत अच्छा question है ये. So basically every day, right, I am feeling like opportunity in government organization is increasing day by day. Every day I am feeling it, right? So whenever you will look closer of all the job opportunities, so no doubt प्राइवेट में तो अपॉर्चुनिटीज बढ़ रही है, राइट, वी ऑल आर अवेयर. गवर्नमेंट में भी यू कैन फाइंड नाउ मोर वैकेंसीज आर कमिंग आउट, डिफरेंट एजेंसीज, स्कूल, हॉस्पिटल्स, राइट, हायरिंग क्लिनिकल साइकोलॉजिस्ट, समटाइम परमानेंट, समटाइम कॉन्ट्रैक्चुअल. सो बेसिकली रैली बिगन्स, right? So you need to travel on this particular rally. So this is the right time to be a clinical psychologist. No matter they are working, they want to work in private organization, they want to work in government, right? No matter where you want to work, but I think this is the right time to, right, take a right journey in this particular rally. So Monisa, hello Monisa. You are mentioning, sir, can you tell me which are the colleges are good for MPhil in clinical psychology in Chennai alone? One thing, Monisa, I will refer this question to UPS team, right, and they will send you the list, right? So one thing you can do, because when I will take a name, right, one or two, that will not help you out, that will be incomplete information. So one thing I am requesting, you can mention this particular questions that you have, right, added here at info.upseducation@gmail.com, right? So they will send you the list of all the colleges around, right, Chennai. That will be government, that will be private, but they will answer you, right? Okay. Hello Hana, Nilima, hello Sayali, hello Minu. Okay, so I'm taking question of Nilima. Nilima mentioning, hello sir, what are the career opportunities in cognitive sciences? One thing, I'm a kind of person, right, जिसको ये लगता है कि what kind of interest you have, right, what is your interest, right, in that particular field you can make your career, right? Don't think about how much opportunities is there, right? कितने vacancies हैं, कितने jobs हैं. If you are really keen in any subject, then definitely you will touch height. Then now you are mentioning कि कितनी opportunities है cognitive sciences में. So in India, what happening, right, in IITs or in prime, right, engineering organization, they are establishing department of robotics, and we all are aware, right, if we are working on robotics without cognitive scientist, it will be very close to impossible. There are lots of things. We are working on AI, different kind of AI. So cognitive scientists, right, they need cognitive scientists for this, right? So if you have interest, right, go ahead, you can choose this, right? Okay. I'm taking one query from Insta. So okay, just wait. I'm not good with all this technology. Sake, sir, when UPS is going to start a school counselor course? Yes, we completed, right, one program on a school counselor. Hopefully, right, within next few days or few weeks we can start. For more query you can contact UPS team, they will help you out. RRSUTAR, I don't know how I can pronounce it, but you are mentioning welcome, right, welcome in session. Sir, I have completed in MA in clinical psychology, but sir, in MPhil entrance exam, in question are going to be general psychology, so I have difficult to understand and read. So what I do? One thing you can do, right, if you have your handwritten notes at master level, no doubt, right, you studied MA in clinical psychology, but वहाँ भी general psychology होगा in first year, like cognitive, in which we can say learning, memory, right, forgetting, reasoning, sensation, perception, intelligence, all these things will be there. So you can either use that particular content, that particular handwritten notes. And if you don't have, right, I always suggesting to contact your mentor, right, request them to help to bring notes and all authentic notes, because that authentic content, right, will definitely help you to understand those concepts that will be important for exams. कभी कभी होता क्या है कि sometime students उस कंटेंट के साथ इन्वॉल्व हो जाते हैं जिसकी रिक्वायरमेंट वो दैट इज इंपॉर्टेंट फॉर साइकोलॉजी टू अंडरस्टैंड ह्यूमन बिहेवियर, बट दैट विल नॉट बी सो यूजफुल फॉर एंट्रेंस एग्जामिनेशन. सो इफ यू हैव दैट काइंड ऑफ मोटो, देन आस्क your mentor to help. They will definitely help you out, right? And try to bring authentic, right, material, right? Talk to your mentor regularly if you have any doubt, any confusion. Don't forget to discuss to them, because only reading is not appropriate. When you have any problem, you need to discuss with your mentor. You need to practice well. Then if you are facing any difficulties in that particular practice, or if you are making any mistake, you need to discuss with your mentor. So when you will contact your mentor, definitely I'm very hopeful that they will help you out. Right? Hello Pranav, how are you? So RT, welcome RT. Pranav mentioning, sir, this Pranav, what is the career opportunities in neuropsychology after clearing MPhil in clinical? One thing Pranav I want to mention, if you want to be a neuropsychologist, then you don't need to go with MPhil in clinical psychology, right? If you want to go, that will be great, because after, right, MPhil there will be many more windows, right, that will open, and that is a different thing. But if you want to be a neuropsychologist, then you can also go with PhD itself, right? If after MPhil if you will go with the PhD, then, right, no doubt your perspective will be broadened, right? You will be able to, right, analyze or think, in broader perspective. That will definitely help you out. But PhD, I will suggest you to do PhD, right, if you want to be a neuropsychologist. And in India, most of the job in neuropsychology, right, will be in government organization, right, in defense, right, maybe you can find in hospital, right? So private practice will be difficult, right? And moreover, your work will not be related to, right, counseling. No doubt you can take it, or you can, right, counsel someone if they have any problem or any issues related to, right, behavior. बट मोर ओवर जो मेरे कॉन्टेक्ट में है उनका जो काम है वो ज़्यादातर रिलेटेड है रिसर्च से, दैट इज रिसर्च ओरिएंटेड, right? They are involved in finding something. So these kind of opportunities you will get. Okay, RT mentioning, you mentioned, right, one question multiple times, so I'm getting it. BHU or nfsu for MA MSc psychology, both organizations are really good, but when you are mentioning these two, और अगर मुझे compare करना है, so I will choose BHU main campus. I'm not talking about associated, college. So BHU main campus I really like main campus because they have, right, few renowned faculties, so you will get right deeper insight from those faculties when you are going to talk with them, so you will learn a lot. So both are the great organization, no doubt about it, right? Okay. Fabina mentioning, hello Fabina, welcome in this session. Sir, I am willing to work in Qatar. I am just post-graduated in psychology. Is there any criteria to have a job there? Fabina, right, you need to contact those organizations who are offering job over there. So when we are talking about psychology, we need to keep one thing in mind very clearly. That is, strongly associated to, culture, society, right? So your counseling, your therapy will be more successful if you know someone's culture and someone's society. So if you are thinking, no, I am able to understand, right, मुझे जहाँ काम करना है मुझे पता है, right, कि cultural aspect क्या है, right, social aspect क्या है, and if any organization offering you job, then definitely you can go there. But this licensing that you are getting, right, for to practice as a clinical psychologist in India, right, they will not work in another country. So just keep this thing in mind. Hello, Atika. Hello, Nilima again. Okay, Atika mentioning, sir, please suggest me any book which is the summary of MA psychology preparation. I'm going to start. One thing, right, Atika, if you are going to begin with MA psychology entrance preparation, so I will suggest Introduction to Psychology book in the beginning, right? That will be a summary. So there are, so many books are available in the market, right? Maybe Barron, maybe you can find Cicerelli. My favorite is Rita Atkinson and Hilgard. So there are so many. You can pick any one according to your convenience, or जिसका language अच्छा लगता है, you can choose, right, any of those book and you can start with, right? And all the best, right? Okay, next is Rehnuma Riaz. Hello, Rehnuma. Sir, please suggest me the objective book for MA, right, entrance psychology. Okay, right, Rehnuma, right, you will really face difficulties to find those kind of books. Basically, right, there are so many books, right, but there are so many mistakes, typo mistakes you can find. So what happened when you are practicing from the book, and right, if there are typo mistake, if there are problem, so that mislead us, right? So that is the problem. But one thing you can do, right, I'm not going to suggest a specific book, but you will find so many, right? If you are not going to find such books, so you can use, right, previous year question paper, right, of DU, Jamia, of various organization, as well as, right, you can also use UGC NET previous year question paper, right? But I'm going to suggest you to use previous year question paper of different universities. That will help you out. Fine. Okay, Arju mentioning also, sir, please can you guide if we need to focus on industrial psychology for MPhil exam, specifically for NIMHANS? Yes, right, ये भी query बहुत common है, right? Because, right, I'm going to participate in clinical psychology entrance examination. So do I need to study industrial? Yes, definitely, because there are few important theories in industrial psychology as well. Like, there are so many theories related to motivation, and in examination, in MPhil clinical psychology exam, you can find, right, two questions from, right, motivation, right? One question could be, right, you can find questions from leadership, you can find questions related to appraisal technique, right? So yes, few questions you can find in MPhil clinical psychology. So yes, you cannot ignore them out, right? You cannot ignore, but yes, right, limited time you can devote for industrial psychology as well, right? Okay, welcome Rehnuma. Sanjeevani mentioning maximum institutes offering MPhil don't show the marks obtained in entrance exam. How to understand what is the cutoff marks to crack entrances? How to understand how much more I need to improve? Yes, your right question is very genuine. We don't know how much marks we are getting, right, in different universities, different organization. So personally you will face difficulties कि कितने marks आए, कहाँ improvement की need है. So yes, right, there are no any way, right, to understand it, to get it, right? But UPS education helping students in that particular manner, right? All the students who are right, enrolled with us, right, we are trying to find, right, their marks and all. We are trying to understand, right, where they are facing difficulties, and accordingly, right, we are making our mock test self-assessment. We are offering mock test self-assessment to the student, but personally it will be really difficult to find. You are right. So these are the things, right, that we need to convince, right, organizations कि वो at least marks जो हैं वो announce करे, right? Few organization announcing the marks, but maximum not, right? So we are also requesting, right, those organizations. Hana mentioning, hello Hana. I have finished my MA in psychology and have taken a gap for 5 years. will I still be able to go for MPhil clinical psychology after all these years? Hana, one thing that I want to mention, and I always repeat in my session, psychology is an open subject. जैसे एक एग्जाम्पल हम लेते हैं केमिस्ट्री का, अगर किसी के पास 10+2 में केमिस्ट्री नहीं था, ग्रेजुएशन में केमिस्ट्री नहीं था, so it's really very difficult and very close to impossible to start making career in those particular domain. But psychology is an open subject. अगर किसी ने 10+2 ग्रेजुएशन में भी psychology नहीं किया, they can pursue psychology directly in MA. I'm saying it because psychology is a kind of subject you can start anytime. So if you facing difficulties just because gap है 5 साल का, so you need to do more hard work, right? But you are mentioning this question here, that means you are passionate about this particular subject. So why not, right? Just start doing preparation, right, for MPhil clinical psychology. You can do it, right? Anyone can do it, right? So systematic preparation, discipline, and passion, dedication for this subject, will help you out. So I suggest you to come in this particular field, and if you want to be a mental health professional, right, so just start acting now. Hello Alka, how are you? Alka mentioning, sir, as MPhil entrance date is outed for NIMHAN, so what should be our preparation in this level in 1 month? Alka, one thing, no one can prepare any MPhil clinical psychology entrance exam in 1 month, but if you are preparing from last few months, then I will suggest you to now practice through mock test. If your preparation is also completed, almost completed, so you can use mock test now, because at the last time mock test will help you to cover the complete syllabus, to revise the complete syllabus. So I am suggesting all my students, जब भी मैं क्लास लेता हूँ, कि if there will be 1 month, किसी एग्जाम में अब 1 month का ही टाइम है, so just start using mock test, that will give you a proper, what we can say, exposure to all the syllabus, because mock test में हर chapter से, हर part से question होगा. So if your preparation is almost completed, then find objective questions and just start practice now, do practice जितना ज़्यादा possible है, जितना ज़्यादा practice कर सकते हो, just be involved in the practice. That will help you, and few things as I already mentioned in the beginning, कि कुछ chapters हैं that is really very important, but don't try to complete them in a limited time frame. Just try to understand what happened. Suppose that अभी मैंने preparation start किया है, बस अभी start ही किया है, और 1 महीने में या 1 month में कोई एग्जाम होना है, या अभी मैंने कुछ टाइम पहले 15 डेज और 1 month पहले अपनी प्रिपरेशन जर्नी स्टार्ट की है, 1 month में कोई एग्जाम होना है अभी. सो व्हाट आई विल ट्राई टू कंप्लीट ऑल द सिलेबस, ऑल द कंटेंट विद इन 1 month. इज इट पॉसिबल? ये पॉसिबल नहीं है कि हम बहुत ही अच्छे से, बहुत ही सोफिस्टिकेटेड वे में हम सब कुछ विद इन 1 month में कंप्लीट कर ले. तो इससे प्रॉब्लम क्या होता है कि मैंने बहुत हार्ड वर्क किया, लेकिन सिस्टमैटिक स्टडी नहीं थी मेरी, तो चांसेस ऐसा है कि मैं अच्छा स्कोर नहीं कर पाऊँ इन अपकमिंग एग्जामिनेशन. उसके ठीक बाद जब वो एग्जाम का रिजल्ट आ जाएगा, फिर मुझे पता चलेगा कि अच्छा नेक्स्ट 1 month में फिर कोई ना कोई एग्जाम आने वाला है, देन अगेन वी विल ट्राई टू कंप्लीट होल सिलेबस विद इन 1 month. अगर उसमें हो गया, आई विश कि आपके फर्स्ट अटेम्प्ट में ही हो जाए, बट अगर नहीं हुआ, फिर उसके बाद कोई ना कोई एग्जाम होगा 1 month में, दैट मीन्स यू विल बी इन ट्रैप. सो आई ऑलवेज सजेस्टिंग कि जब भी प्लान होता है ना कि ओके आई एम गोइंग टू प्रिपेयर फॉर MPhil क्लिनिकल साइकोलॉजी एंट्रेंस एग्जामिनेशन, जस्ट टेक अप्रॉक्स 5 to 6 months, और 5 to 6 month में अपने स्पीड से, जितनी भी स्पीड है आपकी, उस स्पीड से यू कैन जस्ट reading the content, just enjoying that particular content, apply your reading or knowledge on objective questions. So एक टाइम के बाद 4 to 5 months के बाद you will realize कि वहाँ बहुत improvement है. Now you are able to score well in different chapters. So that will definitely help you out. If your preparation is almost completed, then mock test will be the right strategy जिसको यूज करना चाहिए 1 month के लिए. And I mentioned already in the beginning, I'm repeating it for one more time, cognitive, bio, human development, like personality, right? All these things will be really crucial for MPhil clinical psychology entrance. Okay, Sanjeevni mentioning, sir, I am enrolled, right, for the online MPhil plus net coaching with UPS Education. I score 70 to 75% in the mock test and rank is average within 1 to 10, right? Okay, your rank is 1 to 10. Okay, great. So how should I interpret this? Is it good enough? One thing, Sanjeevni, right, पता है क्या है, right? As a mentor or as a student as well, हमें हमेशा we need to think like there are, right, improvement, right? There are, right, what we can say, यहाँ अभी improvement होना है, right? This is not ultimate level, right? So we can improve, you can improve your marks and all. So if you are getting 70, 75, usually we are considering them good, we are considering them above average. But if you are scoring 70, 75, believe me, you have potential to score more than it, right? So if you are scoring 70, 75, why not you are trying to 75, 80, right? So जहाँ problem है, if you are facing any problem in any chapter, just go with their explanation, right? Just try to understand कि किस chapter में problem है, because there will be chapter wise analysis as well, because you are familiar with that particular e-learning portal, so you will get rank as well as chapter wise analysis. So just try to understand in which chapter you are facing the problem. You can mail to UPS Education, right? They will suggest you few things. So, right, if you are getting 70, 75, that is above average, but why not we can try for 75, 80 then, right? This is the thing. Okay, so welcome Alka. Hello Saloni, how are you? Saloni mentioning, good evening sir, good evening Saloni. If I want to pursue forensic psychology, I have done BA plus MA in clinical psychology. Where can I apply? Earlier nfsu had MPhil forensic psychology, but now they only have MSc. One thing, right, Saloni, yes, right, MPhil is discontinued, right? MPhil in clinical psychology will not be discontinued, but बाकी जितने भी MPhil थे वो discontinue, right, हो जाएगा या हो गया according to new education policy. So you can approach them for the PhD, right? So why you are going for the MPhil? MPhil हो गया, that's fine. Now you have option, right? PhD, right, in forensic psychology. So I suggest you, because nfsu is one of the prime organization, right, for right, forensic, right, sciences, forensic psychology. So just approach them for PhD, right? So now I'm taking, right, few queries from Insta, and then we will wind up this particular session. Sorry, I'm not able to take all the queries. But I'm trying to take different kind of queries. Mathur, Tina. Hello Tina, how are you? Any tips for cracking NIMHANS MPhil entrance examination? Tina, I already mentioned various things, right? Things about NIMHANS entrance examination. So what I do, I will save this video, right? So you can watch it, right? Or in the beginning, I explained what we can do, right, for right, NIMHANS entrance examination. So that can help you out, right? Okay, so hopefully you enjoyed this particular session. Okay, there are one sad sign. Okay, so ये ले लेते हैं query. Then we will wind up. Okay, Sanjeevni mentioning, I get very disappointed and sad when I felt my exam went good but still did not crack. Recently gave pass entrance. Any suggestion how to keep up confidence? Sanjeevni, one thing that I want to mention, when any individual, right, going to pursue medical career, there will be one entrance in a year, right? सेंट्रल गवर्नमेंट का 1 होगा, एक when any individual going to pursue their career in engineering, right? So central government organizing one, right, centralized entrance examination. But in MPhil what happening, जब भी हम एंट्रेंस देते हैं अगर नहीं होता सो वी एक्सेप्ट कि चलो ठीक है पहला एग्जाम था, हम सेकंड देते हैं नहीं होता, थर्ड देते हैं, जब 3-4 दे देते हैं ना उस टाइम इट्स वेरी नॉर्मल कि थोड़ा सेल्फ डाउट स्टार्ट होता है, राइट? सो ये बहुत स्टूडेंट के साथ होता है एंड आई फाउंड मेनी स्टूडेंट्स कि जो बहुत ही राइट एवरेज ऑर्गेनाइजेशन में नहीं होने के बाद देयर सेल्फ कॉन्फिडेंस वाज एट लोअर साइड, एट बॉटम. वी टॉक टू देम and they right tried to boost their self confidence, or after few months they cracked NIM hands. I mean to say your exam was good over there, right? किसी इंडिविजुअल का 1 मार्क्स ज़्यादा होगा दैट्स वाई दे वॉज सेलेक्टेड, और 1 मार्क्स कम है दैट्स वाई दे आर नॉट सेलेक्टेड. सो बेसिकली वन एग्जाम, इफ एनी इंडिविजुअल गेटिंग, सपोज दैट इफ एनी इंडिविजुअल गेटिंग 89 and if other individual getting 80, and if 80 who got 80 they are selected, you cannot say who got 79 they are not right, you know, good student, or right उसकी जो कैपेबिलिटीज है वो उस स्टूडेंट से कम है जिसको 80 मिला है. सो डोंट थिंक अबाउट इट, राइट? जितना ज़्यादा हम सोचते हैं कि यू नो मेरा एग्जाम अच्छा गया था, सेलेक्ट नहीं हुआ, यू नीड टू अंडरस्टैंड कि सीट्स इतने कम हैं, इतने कम सीट्स हैं कि नो वन कैन बी सो कॉन्फिडेंट कि मेरा यहाँ हो जाएगा, राइट? बट वन पॉजिटिव थिंग दैट यू आर मेंशनिंग, यू आर थिंकिंग योर एग्जाम इज गोइंग गुड, सो इसको कंटिन्यू रखते हैं, राइट? दिस इज अ पॉजिटिव यू नो वे टू थिंक कि ये एग्जाम मेरा अच्छा गया था, राइट? एंड यू विल डेफिनेटली गेट द रिजल्ट, राइट? सून मे बी, राइट? इस एग्जाम में नहीं आया, अगले एग्जाम में होगा. बेसिकली इतने सीट्स कम हैं कि राइट थोड़ा सा राइट प्रॉब्लम होता है स्टूडेंट्स को, क्योंकि कितना भी अच्छा स्टूडेंट हो, कितने बच्चों का सिलेक्शन होगा? ओनली 8. कितने बच्चे एडमिट होते हैं, राइट? 200, 300, 500. तो कुछ टाइम देना पड़ता है, राइट? लाइक एक एग्जाम हो गया दैट्स फाइन, कुछ ना कुछ लर्न करने को तो मिला ही होगा, राइट? नाउ यू आर इम्प्रूविंग योर सेल्फ, राइट? दूसरा एग्जाम आएगा, चांसेस विल बी वेरी हाई दैट यू विल बी सेलेक्टेड इन दैट, राइट? सो जब भी हम किसी एग्जाम में फेल होते हैं तो हमें इस तरीके से नहीं देखना कि आई फेल्ड इन दैट एग्जाम. वी नीड टू अंडरस्टैंड वी आर गोइंग यू नो क्लोजर टू आवर सक्सेस because you are mentioning, right, your exam was you know good. So just think in this particular manner, that will definitely help you out, right? Okay, last RT mentioning, thank you sir, welcome RT. Which degree would be better to become a clinical psychologist, MA or MSc? RT, there are no such fundamental differences or significant differences in MA or MSc, right? Because few universities, right, placing right postgraduate in psychology in their humanities branch, right, in social science branch, or sometime in science. So like in Bangalore University you can find MSc in psychology, in BHU you can find both MSc in psychology, in DU you can find MA in psychology. But when you will go right to go to you know observe their syllabus, you can find that there are no significant difference in MA or MSc. So don't worry, right? You can take right admission in good college, right? चाहे वहाँ MA हो या MSc हो, and then after completing MA MSc you can right take admission in right MPhil Clinical Psychology. So thank you so much, right, for participating in this live session. I hope राइट कुछ न कुछ राइट हमने प्रोडक्टिव बातें की होगी, राइट? कुछ न कुछ सीखने को मिला होगा, राइट? एंड वन थिंग दैट आई ऑलवेज राइट मेंशनिंग इन माय ऑल सेशन, यू नो you are here just because right you love this subject, right? No matter you want to be a mental health professional, or you want to be a good social psychologist, or you want to be a good right faculty in universities, one thing that I'm confident, you love this subject, right? You are very passionate about this particular subject. Maintain this, right? And take care. See you soon. Bye everyone. Bye.